The Oklahoma Bureau of Narcotics and Dangerous Drugs estimates that 300,000 Oklahomans are addicted to prescription drugs. The vast majority of them get the medications from a doctor or someone they know. In 2012, 844 Oklahomans were killed by an overdose, and most of those deaths involved prescription drugs. A bill which has passed out of the Senate would put the monitoring of drug abusers on the shoulders of registered medical professionals.
According to recent data, Oklahoma pharmacies filled nearly 10 million prescriptions for controlled and dangerous drugs last year. 3.7 million of those were for hydrocodone and oxycodone, both strong painkillers and the top opiates of choice for prescription drug abusers. Oklahoma City physician Dr. Hal Vorse is an addiction specialist and treats habitual drug users who often turn to crime to support their habit.
I just had a young man in the office earlier today who I was seeing for the first time, and his dose was 250 to 300 milligrams a day of oxycodone, which cost $1 a milligram. So his habit was a $250 to $300 a day habit.
Oklahoma ranks 8th in the nation for prescription drug abuse. Daryl Weaver is the director of the Oklahoma Bureau of Narcotics and Dangerous Drugs.
When you look at those numbers, and they've really just been skyrocketing over the last 10 years. So we believe in Oklahoma that we've got roughly 300,000 Oklahomans, or maybe even more, that have a prescription drug problem.
The United States Justice Department this week announced plans to target all levels of the narcotic supply chain, from painkillers to heroin. United States Attorney General Eric Holder says every state in the nation is grappling with the same problems.
Opiate addiction is an urgent and growing public health crisis, and that's why Justice Department officials, including the DEA, and other key federal, state, and local leaders are fighting back very aggressively. Confronting this crisis will require a combination of enforcement as well as treatment.
In Oklahoma, fatalities from drug overdoses climbed 80% over the past decade. According to the Oklahoma Health Department, prescription drug overdose is the leading cause of injury-death for people ages 25 to 64, claiming the lives of 2 Oklahomans a day.
Prescription drug overdoses in Oklahoma now kill more individuals than car accidents. And we know that driving, you have to drive safely and you put on your seatbelt. It's important that we take every step possible to eliminate this plague from our society.
Senator A.J. Griffin is the author of Senate Bill 1821, which just passed the Oklahoma Senate by a vote of 32 to 14. It was drafted at the urging of Governor Mary Fallin.
Language simply requires that anytime a physician dispenses a prescription for a controlled and dangerous substance, that they check the database to make sure that person has not already received that prescription and to see a history of that person's accessing these types of medication.
The database Senator Griffin is referring to is the Prescription Monitoring Program, or PMP, which is administered by the OBNDD. In 2012, Oklahoma law required all pharmacists to enter the dispensing of narcotics to the PMP within 5 minutes of it being delivered to a customer.
If you have a Loratab prescription and you go to your pharmacist, they actually put it in the system. So the doctor can go on, pull up the patient profile and look at and see if John Doe's going to multiple doctors or how many prescriptions of Loratab or whatever they've received.
Dr. Vorse checks the database on every patient he sees, but not all doctors do.
The data would show that a significant number of physicians and other providers in Oklahoma aren't using the system, which is unfortunate.
Dr. Vorse demonstrates that it only takes a minute to check a patient's prescription history for painkillers.
The way the doctor wrote it, it was for 6 tablets a day because 24 was a 4-day supply. And then the pay was paid by insurance.
Dr. Vorse hopes lawmakers pass the law requiring the narcotics database check.
We are a lot more aware of the severity of the problem and more cautious in the way we prescribe. I think we can really save some lives. You know, if we could lower the number of overdose deaths by 20%, we'd save 160 lives a year.
But Dr. Art Rousseau of the Oklahoma Medical Association says in his experience, accessing the database takes much longer than a minute. Rousseau says the association believes the law would burden doctors by requiring checks on too many patients.
We're not just talking about someone who is coming in complaining of pain or back pain and needing narcotics. This would include someone coming in saying, I can't sleep, and do you have anything that you could help me sleep? Or I have anxiety. And this law would include all those types of patients.
Dr. Rousseau is concerned the law would give the OB/NDD director the authority to fine a doctor for not checking the database, even if the doctor knows a patient and their medical history well.
What this bill also does is makes the doctors the criminal, the bad guy, in that if we are not abiding by what this legislation says we should do, the last report I heard was that there was going to be a $2,000 fine per incident.
Unfortunately, whether it be because of intentional malpractice or simply just being uneducated on the issue, we still have physicians that are not appropriately accessing the PNP. They control the keys to eliminating prescription drug abuse in the state of Oklahoma. And this is an area we actually stand a chance to eliminate this problem with our population.
Dr. Rousseau says he and many other doctors check the database on a case-by-case basis, and if they suspect abuse, it is reported.
When doctors have tried to report these individuals who are abusing the system of, getting prescriptions, we're getting no response back.
We do not have the manpower, nor do we want to go arrest everybody out there that's addicted and doctor shop. There's just no way. We don't have the capacity. We don't have the DOC system, correction system to do that. I don't think anybody in our state wants that.
And now a new drug is raising fears the prescription drug abuse epidemic and related overdoses may only get worse. The pain medication is called Zohydro. It's a powerful, long-acting form of hydrocodone intended for use by people with chronic pain. One pill lasts 12 hours.
What we discovered was on the tablet, it can be crushed and it loses its long-acting characteristic and becomes short-acting, but it's 8 times as powerful as the normal Loratab.
National experts have warned the Food and Drug Administration that someone new to opiates could die of an overdose from just 2 pills.
The advisory committee to the FDA voted 14-2 not to approve that drug, and the FDA approved it anyway. Those of us who work in the addiction field, along with law enforcement and the people who are really concerned about the addiction problem, have just been appalled about the release of this drug, because it can't possibly be a good thing.
A check with Oklahoma Pharmacy shows the drug is now available. It's not known whether any doctors in the state are prescribing it yet.
There's really no need for a product like that on the market, and I think we're going to see a pretty dramatic increase in the abuse of that drug. I'm really sorry it came out.
The cost of Zohydro may put it out of reach for some. One pill costs $7 compared to 50 cents for hydrocodone.